Good afternoon, everybody. Welcome today, Buckley program. My name is William Barbie. I'm the events director of the William F. Buckley Jr. program, and it's my great pleasure to welcome you all to this afternoon's event featuring Dr. Scott Atlas and Dr. J. Bhattacharya. Before we proceed, I'd like to say a few words about the Buckley program and the format of today's event. The William F. Buckley Jr. program is the flagship program of the Buckley Institute, an organization dedicated to promoting intellectual diversity and open political discussion at Yale. We have hosted lectures, dinner seminars, firing line debates, and an annual conference every year since 2011. Our over 550 Buckley Fellows hold a wide range of political beliefs, but they all stand united against the formation of a liberal-only echo chamber on campus. By providing Yale students with a forum to engage meaningfully with serious conservative thought, the Buckley program has become an institution on Yale's campus and a symbol for a more open and representative political atmosphere. Especially at a university where the mission is the cultivation and creation of new knowledge, Buckley Fellows believe that all perspectives must be heard and examined in good faith. You can learn more about the program and how to become a fellow on our website at buckleyinstitute.com. For today's event, after introducing our guests, I'll turn things over to them, and after their remarks, we'll open the floor for questions from the audience. Now for our speakers. Scott W. Atlas is the Robert Wesson Senior Fellow in Health Policy at the Hoover Institution. Dr. Atlas investigates the role of government and the private sector in healthcare quality and access, global trends in healthcare innovation, and the key economic and civil liberty issues related to health policy. During the 2008, 2012, and 2016 presidential campaigns, he was a senior advisor for health policy to a number of candidates for President of the United States. He has also advised several members of the United States Senate and House of Representatives and testified to Congress on health care reform. He served the nation from August to December 2020 as a special advisor to the President and a member of the White House Coronavirus Task Force. Dr. Atlas has participated on the World Bank's Commission on Growth and Development. He has also advised leaders on healthcare and medical technology in several communities outside the U.S., countries outside the U.S., including Latin America, Southeast Asia, and Europe. Dr. Atlas has published more than 100 peer-reviewed articles and approximately 200 policy pieces, and has been interviewed in a variety of media throughout the world. J. Bhattacharya is a professor of medicine at Stanford University. He is a research associate at the National Bureau of Economics Research, a senior fellow at the Stanford Institute for Economic Policy Research, and at the Stanford Freeman Spogli Institute. He holds courtesy appointments as professor in economics and in health research and policy. He directs the Stanford Center on the Demography of Health and Aging. Dr. Bhattacharya's research focuses on the economics of healthcare around the world, with a particular emphasis on the health and well-being of vulnerable populations. In 2020, he co-authored, along with Harvard professor Martin Kulldorff, who, for those of you coming to the dinner this evening, will be joining us, and Oxford professor Sunetra Gupta, the Great Barrington Declaration was written, which criticized the implementation of lockdowns to prevent the spread of COVID. Dr. Bhattacharya's peer-reviewed research has been published in economics, statistics, legal, medical, public health, and health policy journals. He holds an MD and PhD in economics from Stanford University. I'd also like to remind everyone that disruption of an event is not consistent with Yale's policies on free expression. I would ask that each of you respect the right of our speakers to be heard and the right of your fellow audience members to listen to the event. Thank you for joining us in upholding our university's core values. And without further ado, I hope you'll all join me in welcoming Dr. Atlas and Dr. Bhattacharya to the Buckley program and to Yale.
Okay, well, thank you for the introduction and thanks for the invitation. Great to see everybody. I'm going to read a few remarks here and then hand it over to Jay. As a health policy scholar for more than a decade and more than 25 years of experience as a medical scientist and physician, I was called by the White House in July of 2020 and asked to help my country during the biggest healthcare crisis in a century. All policy considerations I recommended to the White House were designed to reduce both the spread of the virus to the vulnerable and the totality of harms of the policies themselves. especially to those impacted the most: low-income families, working-class Americans, the elderly, and our children. That is the importance of health policy experts, my field, with a far broader scope of expertise than that of virologists or epidemiologists. And the historical record is clear, and it's not a partisan political issue. 2 administrations, Trump and Biden, rejected basic biology and the data and allowed the pandemic guidance to be lockdowns, led by Anthony Fauci and Deborah Birx, along with the CDC and other bureaucrats. And it was a tragic failure in deaths per million, among the worst compared to all peer nations, a straight line of increase in deaths per day for 2 years, from March 1, 2020 through April 2022, no change in the slope of the line even after the vaccine became available. The Birx-Fauci policies were implemented throughout most of the nation, and the policies failed. In addition, they inflicted massive health damages, death, and destruction, particularly on the poor and our children. And today, science, public health, and leadership in America are in crisis. The pandemic exposed more than a fundamental lack of critical thinking. We saw a disappearance of America's moral and ethical compass, so pervasive that we have rightfully lost trust in most of our institutions and leaders, trust that is essential to the function of any diverse, heterogeneous society. And today, the free exchange of ideas, the essential to finding truth, fundamental to any democracy and any free society, is under threat. What happened briefly? First, academic scientists and public health leaders falsely claimed and convinced the public that a false consensus existed on the following: that the SARS-2 coronavirus had a far higher fatality rate by several orders of magnitude than the flu, that everyone had a significant risk to die, that no one had any immune protection, that everyone was equally dangerous and spreads the infection, that asymptomatic people are major drivers of the infection, that locking down will stop and eliminate the virus, that masks will protect everyone and stop the spread, and that immune protection is only from a vaccine. All of these things were false. They were known to be false in spring of 2020. Not newly learned from data in 2020 later, or 2021, or 2022. Secondly, they hid from the public that lockdowns were known to be ineffective and extremely harmful. In fact, not the standard for pandemics. They were explicitly recommended against 15 years earlier in the classic review by Henderson in 2006. Third, academic scientists use overt propaganda, lies, and demonization of opposing groups as highly dangerous to convince the public to accept something that was illogical: lockdowns. What did they say? They said if you're against lockdowns, you're choosing the economy over lives. But that was false. That was contrary to decades of economic data showing severe economic downturns kill people, particularly the poor. It was lives versus lives from day one. Secondly, if you're against lockdowns, they said, you are for, quote, letting it rip. That is a bald-faced lie. There is no one that ever suggested let it rip. I never heard the president be advised that. I never advised it. Those words were never mentioned. That kind of strategy was never discussed in the White House. Furthermore, academia worked in concert with a highly politicized, dishonest media to delegitimize the safer, scientifically valid approach. It was independently written by several people. First in March 2020 by John Ioannidis, our colleague at Stanford, then David Katz in the New York Times, then myself, all in March 2020. And that was targeted protection, heightened protection of the people at high risk, because the lockdowns were not protecting the high risk, and opening schools and businesses to stop the destruction of healthy children and the poor. This was repeated for months, and in October 2020, as mentioned, it was codified by my eminent colleagues and good friends now, Jay Bhattacharya, Martin Kulldorff, and Sunetra Gupta. But that advice was rejected, with rare exceptions like Florida. And people in Florida have been living normally for 3 years. Florida avoided most of the lockdown harms, and yes, even with its elderly, high-risk population, had better age-adjusted COVID deaths than 60% of states, had lower excess death increase than my own state of California, which is far younger and has less high-risk people. That's a fact. Students in the audience need to understand that there are fabrications by politicians and the media. We must live in an ethical society, and that means facts matter. And this is the rough data here. Bjornskov, March 2021, 24 European countries, the lockdowns did not reduce deaths. Ben David, January 2021, we did not find significant benefits on case growth. The lockdowns did not prevent the spread. Agarwal, Rand Institute, USC, June 2021, lockdown policies in 43 countries and across the US states led to more excess deaths beyond what there would have been without a pandemic. Herbie, Johns Hopkins, January 2022, lockdowns in Europe and the US only reduced COVID deaths by 0.2% and should be rejected as a pandemic policy instrument, quote unquote. Kirpin, Moore, and Mulligan, University of Chicago, February 2023. The states that opened early had the best performance on death, education, and employment, including Florida and South Dakota. The worst performing states were those with the most stringent lockdowns. Illinois, 46, California, 47, New Mexico, 48, New York, 49, Washington, D.C., 50, New Jersey, 51. Any judgment of the U.S. response lies at the hands of Dr. Birx, coordinator of the White House task force under Trump, Dr. Fauci, the most visible healthcare leader under Trump, and then the official leader under President Biden, the CDC, and yes, the university experts who convinced government officials to implement their radical, blunt, and reckless lockdowns. And of course, on our elected leaders who abrogated their responsibility to lead and hid behind those people. Today, all ethical public health leaders and medical scientists should be openly admitting their errors. But instead, we see an Orwellian attempt to rewrite history, to blame those who criticized the lockdowns that were widely implemented for the failure of the lockdowns that were widely implemented. History's biggest failure of public health policy lies directly at the hands of those who recommended the lockdowns and those who implemented them, not on those who advised otherwise. Beyond that, America's universities and school leaders led what is the most unethical abrogation of duty in our history. That is, when Western Europe recognized the data that there was only a minuscule risk for serious illness to healthy children and young people, most of America's governors closed in-person schools. What happened? More than 300,000 cases of child abuse went unreported because schools are the #1 agency where child abuse is noted. Mental health disorders in teenagers and college-age kids skyrocketed. Self-harm visits to doctors by teenagers doubled to tripled. That means putting out cigarettes on your skin or slashing your wrists. Overdoses, substance use disorders in teenagers increased from 40 to 120%. And of course, the massive learning losses that we have all read about, the largest drops in math since the first assessments more than 30 years ago, and the sinful legacy is highlighted in UNICEF's 2022 update, quote, those learning losses disproportionately affected students from disadvantaged backgrounds, learning losses concentrated among poor students. That is why I say the Birx-Fauci lockdowns were a luxury of the rich. They spared the affluent, the people that live in communities like where we live in Palo Alto, while shifting the burden to the working class minorities and the poor. Beyond the death and destruction, we have a public health disaster in the younger generation. More than half of college-age kids had an unwanted weight gain during the lockdowns, and that weight gain averaged 28 pounds. That's an obesity epidemic. We have taught very young toddlers they're a disease vector. They're a danger to everyone, and everyone's a danger to them. In response to being challenged on the data, what was academia's response? Intimidation, character assassination, and censure. And now Americans are faced with a new status quo. Biased social media has joined the dominant voice on campus to be the arbiter of allowable discussion. When it counted most, during late summer, fall 2020, when the school closures and lockdowns were being implemented, I was advisor to the president. My Twitter account was blocked of what I was saying to the president. My YouTube interviews were taken down. You would think that the American people would want to know what the advisor to the president was saying during a crisis. And let's understand clearly, when you censor science and health policy, it's not just an abstract narrowing of discussion opportunity. People die, and people died from the censorship of correct science policy. As a health policy scholar for over 15 years and a professor at top universities for 30 years, and as a graduate of the University of Chicago School of Medicine, when facts mattered, when medical science was based on critical thinking, I fear for our students. The sad truth is that cancel culture on campus is highly effective. It prevents the free exchange of ideas. But even more destructive to me, it teaches the worst possible behavior to our children, the next generation of leaders. If academic leaders fail to renounce such shameful conduct, many more experts with a reputation to lose will be unwilling to serve the country in contentious times. There are many policy solutions and they are urgently needed, and I'll briefly mention them. Clarify and limit the definition of public health emergency. Force full transparency and enforce strict conflict of interest rules. People don't realize that people in the NIH, the CDC, and the FDA share royalties on the drugs they approve. Eliminate career bureaucrats and insert term limits for agencies. Stop the science cartel of funding research and decentralize it. Encourage outside experts. Hold university leaders accountable. They are paid millions of dollars per year, but they are often cowards. And tie the hundreds of millions of dollars per year that universities receive in taxpayer funding to accountabilities for supporting freedom of ideas. As individuals, each one of us now has the burden of being critical thinkers. The era of accepting people as experts based on their credentials alone is over. But first and foremost, we need individuals with integrity to rise up. Rise up has a meaning. It means speak up, to make your voices heard as we are encouraged to do, as we are expected to do in a free society. In America, we have a disastrous void in courage today. Most alarmingly, unfortunately, at universities, our centers for the free exchange of ideas, our training ground for America's next leaders. To quote C.S. Lewis, courage is not simply one of the virtues, but the form of every virtue at the testing point. We need young people with courage as rising leaders to reinstate the moral backbone, the ethical compass, the basic civility that is disappearing from America. We cannot have a society filled with people, led by people who refuse to allow the discussion of views counter to their own. And finally, to the students in the room, we must never forget what G.K. Chesterton said, right is right even if nobody does it, wrong is wrong even if everybody is wrong about it. Thank you.
There. So I'm Jay Bhattacharya. I'm a professor of medicine and health policy at Stanford University, a colleague of Scott's. What I figured I'd do is I'd just tell you briefly about what the alternate view to the lockdown-focused policy was, what it really meant, what was the genesis of it. And then I'll talk to you about a case that I'm involved with in the federal courts against the Biden administration focused on censorship by the federal government, which might explain why many of you haven't heard this view before or haven't heard it sort of in its full state, or why you haven't heard so many of the statistics that Scott laid out. So in April of 2020, I conducted a study at Stanford, in Santa Clara County, right around Stanford, and then again at LA County, where we measured the number of people in the population that had antibodies. Now, antibodies in April of 2020, if you were around a medical school, what they would tell you is that there's no guarantee that it provides protection against disease, right? So, in fact, what happened was that the, do you mind if it's a little distracting? Yeah, so the death rate that the World Health Organization reported in early March of 2020 was that there was almost 3.4% mortality risk. Is everything okay? What's going on over there? 3.4% mortality. 3 in 100 is an enormously high number. But the problem was that the World Health Organization didn't actually know the mortality risk. The disease actually spreads very, very easily, as we found out these last 3 years. And in fact, in the study that I ran in Santa Clara County, California, April of 2020, it turned out that the mortality risk was actually something like 2 in 1,000 rather than 3 in 100. More than 50 times more people had already had the disease, according to antibody evidence, than had been identified by public health. That result was actually suppressed, right? Very few people learned about this. In fact, I started getting hit pieces done on me and my family. I started getting death threats. It was actually remarkable because for me, I'm a scientist. I publish articles in peer-reviewed journals. I thought I was just doing another study. That result was then, you guys okay? That result was then replicated multiple times, including by myself in LA County later that month, and then by 100 other independent teams that found the same result over and over again. Worldwide, by the end of 2020, the estimate from these studies was that the death rate from COVID infection was somewhere between 2 in 1,000 and 3 in 1,000 for 100 studies worldwide. And in fact, the World Health Organization, ironically, published an article in December 2020 by my colleague John Ioannidis estimating that 2 in 1,000. The other thing that was clear from the data very early on was this very steep age gradient in mortality risk. It's older people that face the highest risk. Younger people and children and young people face vanishingly small risks. It's not that young people can't get COVID. It's not that young people can't die from COVID. It's just that it's in most young people's lives, it's very far from the highest risk. And in fact, one of the highest risks that comes from being young is if you don't go to school. School actually is a tremendously important investment in young people, not just in education, but in the health and well-being in the long term. Closing schools turns out to be a tremendously bad thing for the lives of young people. So let me give you another few data points that you may or may not have heard from if you go back to April and May 2020. In April of 2020, the UN World Food Program estimated that the lockdowns that we just put in place for a short period of time that had caused actually tremendous dislocation, economic dislocation, disruption to supply chains. You remember that? Remember what the trade-off was? The trade-off was we're trading off the economy. Okay, we're going to hit the economy, but we're saving lives. The UN World Food Program in 2020 put out an estimate that because of the economic dislocation caused by the lockdowns, 130 million people worldwide would face dire food insecurity, which is their fancy way of saying starvation. That actually happened. 100 million more people faced starvation as a consequence of the economic dislocation of the lockdowns. In March of 2021, the UN put out an estimate that in South Asia alone, children under 5, 200,000 children under 5 had died as a consequence of the economic dislocation caused by the lockdowns. The trade-off was never lives versus the economy. The trade-off was lives versus lives. And it wasn't just any lives. It was lives of supposedly of people in the West protected by lockdowns, and as Scott said, that didn't really come to pass, versus the lives of poor people, poor children around the world. Those lives were actually lost as a consequence of the policies that we followed. Another estimate by the World Bank in the middle of the summer of 2020 was that 100 million people would be thrown into dire poverty, meaning $2 a day or less of income a day. My mom actually grew up in a Calcutta slum. When I was little, we got to go visit. I lived in that with my relatives there for a month. I saw firsthand what that life is like. It's nothing like the life we have here. We take it for granted what we have here. When the world economy collapses, like it did as a result of the lockdowns, it's the people living in those dire circumstances that face the greatest harm. Let me give you one more data point that came up after 2 years of lockdown. In Uganda, for 2 years, children didn't go to school. 15 million children did not see the inside of a classroom, and they didn't have Zoom because most children in Uganda don't have access to the internet. So it's just 2 years of no school. When the schools reopened, 4.5 million children never came back. The UN did an investigation, and it turns out that many of those children, the young girls, were sold into sexual slavery, 4.5 million, and many of the young boys were put into child labor. What would lead a family to do that? Just think about this. Why would you ever do that to your children? Well, the reason is because the lockdowns had placed so many families in such dire economic circumstances that the choice was between selling your kids into sexual slavery or starvation for your kids. That was foreseeable in April of 2020. As I said, the UN World Food Program already put out an estimate of 130 million. And yet the conversation in 2020 was, we have to lock down or we are going to take human life. The exact opposite was true. So in October of 2020, when Martin Kulldorff of Harvard University, Sunetra Gupta, she's the world's best epidemiologist as far as I'm concerned, and I got together, we wrote the Great Barrington Declaration. Anyone in the room sign it? God bless you. You guys, God bless you. You guys, by the way, you can still go sign it. It's not too late. It's still up. It said two things. It said, one, that there's this enormous age gradient, right, in risk. It's older people that are highest risk, that are most likely to die from getting infected. So it said, do better at protecting older people. 80% of the deaths have been in the United States have been people over the age of 65. When Scott was in the White House, we were talking every day, and I know what Scott was telling the president. Scott was telling the president, we have to do better protecting older people because of that one data point. Second, the Great Barrington Declaration said, lift the lockdowns. The lockdowns are harming the people who are least at risk from COVID and least capable of managing the economic and other psychological and medical dislocations caused by them. The lockdowns are hurting the poor, the working class, and children everywhere where they are. Every poor person on this earth has been hurt by the lockdowns, by the economic dislocation caused by them. I call it a trickle-down epidemiology. It's a policy where the premise is if we just protect the well-off, somehow it'll trickle down and protect the poor. But that was a lie. And so the Great Barrington Declaration called for lifting of the lockdowns and better protection of the vulnerable elderly population. Not just here, but everywhere. And it struck a chord. People from 40 different countries sent us translations from every single continent of the Great Barrington Declaration. Like I said, you can go take a look, and bless you all who've signed. Who's ever heard of it before? I'm really curious. Who's never heard of it? This is the first time they've heard of it. A few of you. Let me tell you why you've never heard of it. In August of 2021, I signed up for Twitter. Now, to you, this doesn't sound, you all are young, and this sounds like not a momentous event, but it was an enormous and momentous event in my life because I'd spent the last decade telling my graduate students, no, don't sign up for Twitter. You don't need to be on social media. All you have to do is do good science, publish your work. That's how you're going to make an impact in this world. I signed up for Twitter, August of 2021. The first link I put was to the Great Barrington Declaration. It turns out, when Elon Musk bought Twitter, I found out that the day I joined Twitter, I was put on a Twitter blacklist, a trends blacklist on Twitter. I got to go visit with Elon Musk. I got to go inside Twitter headquarters and look at the database. I saw my face in the database with the word blacklist right next to it. The question is why? Why would Twitter, a company who's make their money by encouraging people to speak and sometimes mostly yell at each other, why would they want to put me, a professor from Stanford University, on a blacklist? By the way, when's the last time we heard in American history the word blacklist? McCarthy era, 1950s. It struck me as like, this is such strange. I thought that was a thing of the past. I thought we as a society had agreed that we wouldn't blacklist people, even with people who have very, very views that we think as abhorrent. We actually allow that to happen because we think that by allowing the discussion, we can point out why the people that are saying wrong things are wrong. And actually, as a result, we get sort of better outcomes. That's the American sort of ethos, right? That's if anyone's read J.S. Mill, that's the same kind of ethos of basic liberal societies. I was put on a blacklist because the government told and threatened social media companies that there were some ideas, even legally protected ideas, that were so dangerous that it was not okay for the American people to hear them. In August of 2022, the Missouri and Louisiana Attorney General's offices asked me if I would be interested in joining a lawsuit against the Biden administration. Now, by the way, this censorship regime started before the Biden administration, the whole structure of it, but the Biden administration weaponized it. In this lawsuit, a federal judge allowed us to read the emails between the federal government and Google, Facebook, Twitter. What it revealed was a federal government that would directly threaten these social media companies. The government would provide a list of ideas and people that they wanted censored. And then they would tell the social media companies that if you don't censor these people, suppress the reach of these ideas, we're going to destroy you. The government has in its power to do that because the regulations that allow the social media companies to exist are enforced by the government. And in public, President Biden explicitly threatened Facebook. He said, Facebook, you're spreading lies that are causing people to die. The social media companies capitulated, the media capitulated, and as a result, the fact that there was not actually a scientific consensus behind lockdowns became unknown to the public. 4 days after I wrote the Great Barrington Declaration with my colleagues, Stanford, Harvard, Oxford, 4 days, the head of the National Institute of Health wrote an email to Tony Fauci calling me me and my colleagues fringe epidemiologists. I got a card somewhere. I just wonder if I brought it. It says fringe epidemiologist on it. I'm going to go to my grave with the words fringe epidemiologist as the main moniker for me. And then he called for a devastating takedown. The devastating takedown took the form of hit pieces against me and my family. It took the place of propaganda campaigns arguing that I wanted to let the virus rip, when what I wanted to do was protect vulnerable older people. And the other thing that it did is it silenced scientists. Because who wants to be the subject of a devastating takedown? I mean, I see in the audience Harvey Risch, who was a very brave scientist who stood up even despite the devastating takedown. He'll probably be able to tell you all kinds of things that happened in his life. It was very difficult to stand up even if you disagreed with the lockdown policies or any other aspect of the policies as a scientist. And a lot of scientists, even though they actually disagreed, stayed silent. And that's why for some of you, this may be the first time you've heard this view. But I want to tell you is that the idea that there was a consensus in favor of the lockdown policy was a lie. It was an illusion created by a relatively small number of scientists, very powerful ones at the head of federal bureaucracies, that use their power over the social media and over the media in order to create this idea, this false idea that anyone that disagreed with them was spreading anti-science or was wrong. In fact, there was considerable debate over the lockdowns. And Scott said that if censorship hadn't happened, people would have lived. That's literally true. I very strongly believe that, because I believe that had there been an open and honest debate about these policies in 2020, 2021, 2022, and into 2023, these policies could not have lasted as long as they did. Many of you young people suffered through the consequences of these policies. Your schooling was disrupted for 2 straight academic years. And you were told that these policies were necessary to protect your parents, to protect your grandmother and grandfather. That's actually a lie. And let me just end with a data point to show you how incorrect that was. In April and March of 2020, the Swedish health authorities faced the same question: should we close schools down? They decided that for children under 16 and under, they would not close a single school. Children in Sweden, all through 2020, all through 2021, 2022, and 2023, had no disruption to their lives. No masks, no social distancing, no Zoom school, just regular school. And let me ask you, okay, this is not fair because Scott already gave it away. Which country in Europe had the lowest, or depending on how you count exactly, the second lowest all-cause excess deaths? Which country protected life the best all through the pandemic? Sweden. Sweden has the lowest all-cause excess deaths. It's lower than Finland, lower than Norway, lower than Germany, lower than all of its neighbors. There's some debate about Denmark. Some people have a different baseline, but it's like basically, neck and neck. Most of Scandinavia was pretty light on the lockdowns. Let me give you one other. I said only one data point, but I'm a professor, so I can get away with a second. If you compare California, where my kids didn't see the inside of a classroom for a year and a half, and Florida, a state where I was an expert in a school opening case that resulted in kids being able to go to school in person in 2020. Which state had lower all-cause excess deaths, age-adjusted, Florida's older, age-adjusted, all through the pandemic? Florida or California?
This I already did say.
Did you say this? Yeah. Oh, man. Florida. Florida had lower all-cause excess deaths through the whole pandemic. And if you tell that to people, they're surprised. They say, why? How could that be? But the roots of the answer to that question are what I started with. Lockdown is trickle-down epidemiology. Asking people to lock down, especially poor people to lock down, is inhumane. It's destructive, and it can't go on, and it doesn't. What actually happens in the lockdown is that some people continue to work and make the rest of society function so that the richest people at the top, the laptop class, can live thinking that they're being safe and virtuous. It's the most unequal policy, economic policy I've ever seen in my lifetime. And yet, vast numbers of people, both on the left and on the right, adopted it. And we should never do it again. Thank you.
Thank you both for those remarks. I think we're going to turn it right over to the audience for a Q&A. So if anybody has a question, just raise their hand. I'll hand over the microphone. Always takes a minute.
Sure.
Thank you. Thank you both. Okay, cool. Thank you both for coming. My name is Viktor Babinski. I'm a graduate student here. Well, first of all, I would like to thank Dr. Atlas, whom I've listened to last year at Hoover, and who was the first person who've articulated so eloquently this case for the failure of our leadership and the lockdowns. I've never heard anybody articulate this way before, and it really had an impact on me. In March 2020, I was a college student in the UK, so it was a 3-year college, in the second year. And when the government told us to go back home for 2 weeks, 3 weeks maybe, just to wait this out, we did, and we never went back to school. And well, I think all of my peers were, our lives were severely disrupted. We never got to finish our college in a normal way. Nobody helped us with the rent payments, which in London aren't that low, as you may probably guess. So over the last few years, I kind of wrestled with this question of what happened to us, the students, but also my friends who were younger and were in high school. And I wanted to ask both of you if you think that there was some sort of a conscious or maybe subconscious decision to throw the young generation under the bus in order to presumably protect other people, even though, as you argued, that might have not worked out that well. Thank you.
Well, I can take a stab at it. You know, this is one of the most heinous sins of the whole pandemic management, which is that, and it goes into the story about the vaccines, but if you believed, which many people do, but it's completely false, as proven by the data all over the world, if you believe that the vaccines are very robust at stopping the spread of the infection, even if you believe that, that is the reason why most people are saying children, young people should be injected with the vaccine. I'm giving a more explicit example of sort of using the children. I'm not sure what kind of society uses its children as shields for disease to protect adults. I think that is the most shocking thing that happened. You know, I'm a father, I think many of us are. My children are not to be used as shields for me. I'm a shield for my children. So that is an explicit example of what you're talking about. The other examples, and this is sort of a random thing, but I was fighting in the White House to get schools open and universities open because these people were so, I mean, I hate to say it like this, but they were so stupid. They thought that it made sense to close a college campus where there's very low risk pool, generally speaking, because you have to realize the data is that people under 20 have almost no risk of a serious illness from COVID who are people who are healthy. Okay, that's just a fact. I can go into that. Instead, they were saying we should close that environment and send these kids back into their homes or in the community where there are far more high-risk people, including their parents. I mean, this made absolutely no sense. And I wrote a piece in September of 2020 while I was in the White House, and it took a lot to get this thing published. It's in the New York Post, on open the colleges. And this was just somehow, it was just completely, really brought out a lot of antagonism by everybody all over the world. So the risk, and Jay pointed this out, was that the lockdowns were actually destroying people because they were doing a couple of things beyond what was said here. They were keeping people indoors, which is where all the infections spread. I don't know if you guys saw these videos of people in San Diego being they put a police boat and go get a guy who's a surfer way out there, or close the parks in California. They were arresting people in the parks and forcing them to stay at home, where of course you can't shelter your grandparent if you're living with your grandparent. That's impossible. The second data point I want to mention is that, Jay mentioned 65 and over is about 80% of deaths. 2/3 of deaths in the United States were in people who had more than 6 comorbidities. Okay, it's not even just old people that were going to die. It was old, very frail people. In Germany, Jay mentioned the Sweden data point, but in Germany, during 2020, which is the most lethal form of the virus, because you realize the virus has mutated now and it's less lethal. During 2020, there were 0 deaths of children over 4 years of age in Germany at the most lethal time of the virus with no vaccine. 0 in the country. I mean, this is shocking that people don't even know this. I mean, there's so many things to say. So the answer is, I don't believe in a plot, but I do believe there was a societal collapse of morality here with this children. I mean, can you imagine that where Jay and I work at Stanford, but also at these other so-called elite academic medical centers, Hopkins, many of them did an NIH clinical trial of the vaccine in young children, an experimental drug to protect against a disease that young children have no significant risk from, healthy children. And they injected that in a clinical trial, and the sponsor of the clinical trial was Pfizer, the vaccine maker. I mean, this is a shocking, Jay and I are sort of brothers from another mother at this point, but we were both very naive to what these things were, because we were idealistic about science, and we don't have that kind of background in politics and all this. But these kinds of things are shocking to me. There's a collapse. Where were the ethicists? Where were the teachers who were trying to get the schools closed? Where were the psychiatrists and the child psychologists? This stuff was all predictable and actually documented by spring of 2020. 1 in 4 college-age kids thought of killing himself in the United States by June 2020 because of the isolation, not the virus. I mean, this is a massive, heinous illustration of a combination of fear and also just really revealing, I think, something that we don't even want to talk about.
Can I add to one really brief point? If I could get the second, I know there's another question. The question is, to me, has been, why has more young people not spoken up? And I have to say that, because I was expecting it, right? I was expecting it's young people that paid so much of the harms of the lockdown, and yet young people didn't really speak up in large part. And I think I don't know, again, I can't answer your question directly about whether it was intentional, but I'll tell you there was an intentional tactic used by public health in messaging to young people. The tactic has 2 points to it. One was to overstate the risk that young people actually faced from the disease. And then second, to weaponize the empathy that young people have for the rest of society against young people themselves, right? So you remember, you have to wear a mask to protect your mother, your grandmother, not for yourself. That is a very clever bit of behavioral psychological tactics, right? It's designed to take, you all are kind people, you want good for others, and it's taking that good thing about you and then essentially playing with that so that you are willing to comply with orders that are against your own interests. And then undermine your ability to ask questions about that. Whether, is it really protecting grandma? Why does wearing a mask outdoors protect anybody when the disease is dissipated really easily outdoors? Why should I wear a mask alone in a car? Anyone see that?
You still see it.
You still see it? I mean, that's why you know there's been some psychological programming going on. I think that's the answer. Why? I think the main reason why you didn't see young people rise up is because the psychological techniques to convince young people that they were a danger to society, felt yourself a danger, and so you would comply with the orders that you received. That was wrong. It was unethical and wrong.
If I can add a data point that I always forget to say, about this idea of closing colleges and what happens to people. There's good data that shows that it's minorities and single-parent families. Those kids, they don't go. Once the school's shut, they just say, okay, that's it, I'm going to go to work. There's a huge discrepancy. And so you've created a lot of kids in a society that gives a lot of, words to equality and things. All of this stuff directly harmed lower income families, minorities, and the poor. There's a statistic that over the next 20 years, 1.2 million Americans will die from the lockdowns, just the unemployment from the lockdowns. And the overwhelming majority are African Americans and women. And this is the society that purports to care about poor, about low-income families, about minorities. I just think, there's a reality and there's words. And as you can tell, we're pretty direct speakers. And I think we need more discussion, because the solution to misinformation is more information, not censorship. Because you don't trust the people who are censoring because they were wrong in so many ways. And they're still censoring, by the way. It's still happening. It's not solved yet. Jay is the optimist and says, no, Scott, we won the argument, and that's sort of true. But
the Supreme Court is going to rule for us in this Missouri recycling. In fact,
no, that case is definite.
Yeah.
But this is low-hanging fruit, by the way, if I may speak off the. And I'll tell you why. Because this was so explicit. The government ordered these companies. Okay, that was like a very good lawsuit, and but it happened without the government intervening. Okay, I was in the White House in the fall of 2020, and I saw them censor, myself, but also they censored what Trump said. Okay, I don't care if you believe what Trump says or not. He's the president. He ought to hear what he's saying. And they decided they're going to take him down. They're going to block it. And I was in the room on one or two of these calls to these companies, and they just are not interested in information. They're interested in what they want people to hear. And I think it's very dangerous because it's a harder case to win against a private company who's not ordered by the government. Yours, okay, this is so blatant that it's shocking that it happened, but there's a lot more of it that needs to be undone.
There's a question right here. There.
Hi, thank you. From a research perspective, how do you measure excess deaths, and how do you establish those counterfactuals? Do you feel confident in that information?
Yeah, so there's a lot of, you can probably imagine, there's a lot of fight over the answer to that question. I think a sensible approach is we hear about excess deaths in the pandemic era, right? So we want a baseline from just recently before the pandemic. So one way to do that is you look in the country, the same country. Let's say Sweden in 2015 to 2018, or 2010 to 2015, or whatever. You can pick some time period, and ask for each age group, what's the death rate in that time period, and then what's the actual death rate you observe in 2020, 2021, 2022. The old period by each age allows you to get an expectation about what you would have seen without a pandemic, and then you see what you actually observe. So excess death is the difference between that. There's a lot of fight over exactly how you set that expectation, but they all give the same answer. This is why I hedged about Denmark. Some ways that they talk about they measure the baseline, Denmark comes out better than Sweden, just barely. And many, many other ways, Sweden comes out better than Denmark. But every way, Sweden comes out either first or second, the lowest on the bottom.
And not just in Europe, in the OECD, all the nations that are developed in the country. But Jay said this correctly, but I also want to add that the excess deaths is, I think, universally thought of, the change in excess death, as the best way to measure what happened, because you have deaths from the pandemic and you have deaths from people killing themselves or whatever from the So, and then second point is that the COVID deaths per se, it's not really clear how many COVID deaths there were, because they called somebody a COVID death who came in for appendicitis, had tested positive for COVID. It This is documented. So I'm just saying that you get rid of all those questions. If you're just about who died versus an average of the pre-pandemic years, usually it's 3 to 5 years. And you compare it to that.
And you're able to disentangle to the best that you can from COVID and
So that's the thing. You can't. You're like it's like a summary measure, right? You're not disentangling. You're saying, COVID happened. How well, if you protected well against COVID, you should have presumably lower deaths from COVID, but you might have caused deaths from the lockdowns. So it's a summary measure. It's like, let's say, how well did we protect human life with our policies?
And you may ask, how could you kill somebody by a lockdown? I just want to say a couple things. 40 to 50% of acute stroke patients and acute heart attack patients didn't call an ambulance because they were afraid of going into a medical facility. About 2/3 of cancer patients didn't get their test for the screening. Something like 60% of chemo patients in the United States during 2020 said, I'm not taking my chemo. These are diagnosed cancer patients on chemotherapy. Okay, so they actually killed people by shutting down medical facilities. 85% of organ transplants didn't get done. The people still had the organ failure. So they killed people by shutting down medical care and by making people so terrified of going into a medical facility. They literally killed people.
In the poor countries, they killed them by starvation.
And in addition to all these other.
I mean, I think this is why all-cause excess deaths is such a nice number. It's a depressing number, but you know what I mean. It's a nice number in the sense that it provides a summary measure. And then now we can argue about what policies were best, and tease it apart because we have a baseline of expectation.
But in the end, of course, the purpose of the lockdown is to save people's lives. So you have to prove that you saved people's lives because you did a lot of bad things to them. You destroyed the children's schooling, you created problems with unemployment, all these things. So you better have data that shows the burden's on you. You had to do better with lives than the people who didn't do the lockdowns. And in fact, the opposite was shown.
How about over here?
So I was really excited to see that you guys were coming out because I've read some of your work before. I'm an undergraduate, but I'm also a mom. I have a 1-year-old baby. And I'm trying to avoid giving her, a sketchy vaccine that is not necessary for her. Everything else, every other vaccine we'll give her, obviously. But until she's at a point where, she actually has risk factors, God forbid, it doesn't make sense. So how should people be navigating an environment where vaccines are required? So many places, schools, daycares. Yale requires the vaccines for all intents and purposes. How do you navigate an environment like that?
So Stanford finally said no longer requiring the vaccine. The short answer is you're doing the right thing. Make sure your child gets all the other vaccines. MMR, DPT, it's very, very important for the health and well-being of your child. For this vaccine, I don't see any real reason for young children, especially toddlers, to be vaccinated with this vaccine. They face almost zero risk. Healthy vaccine, yeah, healthy toddlers, and they don't. And the key thing is that your child getting the vaccine won't protect you from getting it. And if you got it, you'd be fine too. You're young and healthy.
Can I just say that in terms of protecting others, the data on the vaccines is that anywhere from 30 to 60 days, the efficacy of stopping the infection drops to 20%, 20 to 40%. It's very, very low. So after, say, 6 weeks, there's not much protection anymore. And you can get infected, and therefore you can spread the infection. So there's no durable protection. There's no benefit to others by you getting vaccinated. The benefit is a personal benefit. If you're a high-risk person, there's good data to show, particularly during the 2020 phase of the virus, that fewer people died who were high risk, who had a significant risk to die. But now we're in a different situation. Okay, we have a virus that's morphed into something that's very less lethal. We have 90+% of people have biological protection from having had COVID in the United States. We've had all the high-risk people essentially have been vaccinated who wanted the vaccine. It's just a totally different situation. But there's the way I like to say it is and I don't know how Jay says it, but the vaccine is not a public benefit. It's only about you personally. It does not stop the spread of the infection. That's fact. That's the data that was submitted to the FDA, by the way. That's not a editorialized comment.
And actually, the answer to your second part of your question, how do you navigate these restrictions? Most places will let you have exceptions if you ask for them. So ask for them. Insist on them. And then if some place won't give you an exception, go find some other place. Like I'm pretty sure Yale will give you an exception now, because these facts, they know them. Right? They know they're not protecting anybody.
They only give a religious.
I think it's very difficult.
You have a religion of science that you follow. You know, it's just.
Your religion is flat. They have a religion. Their religion is flat Earth, sort of. That's what I say. But you know, I actually think it's very difficult. It's not to be minimized. How do you navigate? Because there is no real good answer to this, in my view, particularly for young people who are concerned about their social network more than I am. I think you have to find.
Me. That's the problem.
Well, we lost a lot of friends, but we made new friends, and that's sort of how it worked. But the answer is you have to find like-minded people. And when you speak up, when you go and say, I'm not going to do that, you're empowering a lot of other people. This is one thing I learned very quickly. People depend on others to be like the first one. Okay, it's not fun being the first one, I can tell you that. But you're really allowing other people to have the courage and to see that they're not alone. And when there's a lot of people that say to X university, you know what, I'm not going to take that vaccine, I'm not going to take that booster. They listen. In fact, I will give my opinion on this. The universities care about two groups of people, the students and the donors. They don't care about the faculty. And so the students are very impactful, though. They really are. And they make bad look for a university when they're protesting a university policy.
Can I tell you a moment I did? I'm really proud of this. So there's a physics student at Stanford in like late 2021. He reaches out to me, he says, he's from Central America. He's like, I'm going to get deported because I took the first 2 doses, but I don't want the booster. And he's a physics student. And he's like, he has a family, he has a young family. He's a daughter and a wife. He's 24 years old. And he's like, how do I, and Stanford's going to deport me because he's not an American citizen. And if he doesn't sign up for classes, he's not allowed to stay in the United States. And then and Stanford's telling him he can't sign up for classes because he hasn't had the booster, which made no sense because boosters cause, high rates of myocarditis in young men for no purpose. So I helped him get a op-ed placed in Newsweek. Then Tucker Carlson reached out to him and asked him if he'd appear. And he's a very handsome young man. That's nothing like me. He's like, young and he's like a physics student. And then miraculously, Stanford said, oh, we can make an exception for you for the booster. I mean, just make a noise.
I think we have time for one, maybe two questions.
Well, we have to have more.
I know. Well, we'll save some for the dinner.
Hi, thank you both for being here. Dr. Bhattacharya, I recently read your piece in Barry Weiss's outlet, The Free Press. I thought it was very good, so thank you for writing that. My question is about current Yale University policy. I was just checking, and it says that if you are experiencing symptoms or you have tested positive for COVID-19, you are required to mask. So my question, I'd love to hear what you guys think about masking policy in general, and also if this policy is consistent with the science.
I'll answer that. Masks don't work, period. Okay? And I'm going to quote the person who did the Cochrane review, the lead scientist of all the sound data on masks. His name is Tom Jefferson. And he said, quote, masks don't work, period, full stop. Okay, I don't talk like that, so.
Well, he's from the UK, so
Yeah.
we would say,
He said full stop.
He said full stop.
And there's two
That means
conclusions.
period in the UK.
I'll go through very quickly the data on masks. May 2020, the CDC published all the randomized controlled trials on masks. May 2020, and said for influenza, masks do not work there's no evidence masks work for the protection of the wearer, nor for other people. Why influenza is relevant? Because it's the same size and roughly as this coronavirus and the same mechanism of spread, basically. That was May 2020. November 2020, Annals of Internal Medicine, great study from Denmark, randomized trial, no significant evidence, no evidence of significant decrease in infections. And the only thing that counts, by the way, is the infection. It doesn't count how many particles a mask stops. You either stop the infection or not. It's yes, no. Okay? So the other side often cites these particle studies. I mean, they're not relevant. It's only about the infection.
I mean,
that was November 2020.
If your glasses fog up, that's like little particles of COVID escaping up and fogging your glasses up.
It's common sense,
masks,
but this is the actual data, okay? And then the Cochrane Review, which was this year, 2023. All the studies on masks, all the good studies, they said two things. Number one, there's no evidence that masks stop the rate of infections, surgical masks. I'm not talking about a cloth bandana. And number two, conclusion, is N95 masks are the same as surgical masks. Okay? N95 masks do not work. That's the Cochrane study conclusion. Now that study has been somehow, criticized. That's not a study. That's all the studies by the most eminent evidence-based. That person, Tom Jefferson, was the director of Oxford University's Center for Evidence-Based Medicine. This is not, somebody who doesn't know how to analyze data. And it's very sad to see this kind of behavior about masks. I understand why people would wear a mask because they're afraid and they've been told they work. And they don't have time to go and read all the data, maybe. I don't know. But I find it very frightening that we're in a world, in a country, that denies fact, that is living in a fantasy. When you look up on Amazon copper bracelets for arthritis, they rank them. Okay, copper bracelets don't work for arthritis. Okay, that's just a sham. And you can put a lucky nickel in your pocket. You can, I don't know, put a rabbit's foot. But the reality is, you can do whatever you want. But when somebody who's, to me, I'll go into this. We got a lot of time right now. But I actually meanly say that is today's IQ test. That is the test that the first question on the debate should be for the Republican president. And I've actually told some of the people that run the debate. Ask them this question. Do masks work to stop a viral respiratory infection? And the answer is no. They do not work. And you can't be afraid to say the truth. I'm not afraid to say the truth.
So let me follow up real fast with 2 seconds. What would be a science-based policy? If you're really sick, stay home. Chicken soup might help for some things.
What's happening now, and I'm going to let you ask your question, but I read that the Biden administration has funded something like $700 million worth of COVID tests now. Okay? There is no dangerous pandemic today. None. There is no health emergency today from this virus. None. There's no public health emergency. There was, but there's not now. And so to take $700 million and fund for COVID tests, I don't understand why people are testing for COVID. Okay? I mean, I just think it's irrational. It's frighteningly irrational. We have 30 to 50,000 people every flu season die in the United States for years. Nobody tests everybody for flu frantically. Okay? 50,000 people, that's 1,000 people a week die from flu. We don't shut schools for that. So I just think we've lost, my wife keeps telling me, stop saying this, but I'm going to say it. America is off the rails. Okay, it's off the rails, and we need people to regain their composure and to stand up for the truth and insist on seeing the data. When I give a slide talk, and I know when Jay gives a slide talk, we show the data. We show the references. When you have people that tell you masks work, ask them what their evidence is that it stops the infection. Not the particle, but the infection.
One more question.
Okay. Thank you so much for being here. It's such an honor to speak with you. I just have a statement, and I'm hoping that gentleman here talked about masking. When is this going to end? You said the test. Even my son goes to college, and they say, if you have symptoms, you test. And one of his roommates was so frantic. I tested 3 times. I don't have COVID. I'm wearing a mask. And my son just said, doesn't matter to me. Don't test. But your point being, and I've talked to a lot of my friends, and I think it's important to speak up, my friend here, the logic has gone. Even a dear friend of mine, she's a preschool teacher, and she keeps getting boosters and masking the children. But I said years ago, we remember our schools, there's a stomach bug going around. There's 300 kids out. What did? We sent our kids to school without a mask. This has been going on for years. So my fear is, when is this going to continue?
Yeah, I'm going to answer,
Can you
and then
please?
I'm going to let Jay give you the optimistic answer.
I'm going to give you an optimistic answer.
My answer is it will never end. Okay, I remember talking to Governor DeSantis back in summer 2020, and he said to me, they will never admit they're wrong. And now I say that too. They will never admit they were wrong, never. And there's 2 reasons. One is they believe it by now. But also, if they admit they were wrong, these are people whose career, they can't. It's human nature. You would have a lot of integrity to admit you were wrong after making those kinds of claims for all these years. And these people do not have integrity, that I could tell you. So I think the answer is they will never admit they were wrong. In places like where we live, in California, we see babies in strollers with masks on. We see people in their cars with their windows rolled up alone with a mask on. We see Stanford University students on skateboards with masks on. And that, it just,
No helmet.
at some point, that's right.
Okay,
At some point, you have to just say.
Scott, I have to give the
Now Jay's going to say,
Scott,
it's over.
Scott and I always agree on almost everything, but this is the one point. I actually am quite optimistic. Like, all of the movement has been in the rational direction, right? I'm looking at this room. Okay, this is a self-selected audience, I'll admit, but I don't see a mask. I teach a class in health economics, and the lecture 3 is the COVID lecture. Right, in 2021, 2022, I gave, 2020 was online, 2022, I gave this, 2023, I gave this. Lectures 1 and 2, 80% of the kids are masked. But I give lecture 3, lecture 4, 10% of the kids are masked. I think data moves regular people. And I think data has moved regular people. It doesn't have to be like scientific studies, although the scientific studies are in what Scott has been saying. It just has to be, you just look around. Has what we did worked? Most regular people come to the conclusion, no. Was it necessary, all this like reorganizing our entire lives around COVID prevention? Like, is that really? It's like institutionalized hypochondria. We can't live like that, and because we can't live like that, we won't live like that. And most people have moved on. I mean, Yale may be a bubble, Stanford may be a bubble, but most of the world has moved on. And it's Scott. This is I agree with. The people that designed the policy, that pushed the policy, and that silenced critics of the policy with inappropriate censorship kind of means, they will never give up. There's a physicist, a very famous physicist named Max Planck. Some of you, any physics majors in the room? Max Planck had a saying about physics. He said, science advances one obituary at a time. Right? The old ideas die when the old guard finally lets go. Right? And that's, I think, going to be the case with the top of public health. I'm not expecting that to ever happen. But a new generation of people who enter public health, who enter science, will have a very different view. And you guys are going to judge us very harsh, not me and Scott, I hope, but everyone else very harshly.
I will say the one closing point about this. It took the Catholic Church 359 years to formally admit that Galileo was right, the earth moved. And they formally admitted it. It's in the paper. In Rome, I show it at the talks that I give.
That's a 2,000-year
359 years. So
that's
I'm not sure I'm going to be around that long to see that admission.
We're immortals. So 2,000 years of a church, just 300 years is nothing. It'll be faster than that, Scott. It'll be faster than that.
Well, let's please give another round of applause for our guest.